and especially during the prenatal, what actually happens is, so in some cases what actually happens is the women, they tend to eat some kind of contraceptive pills even though they are pregnant. And however, with that contraceptive pills, they are not able to abort the child, and the child continues developing, and that actually causes problem to the children. Not only that, we happen to see many kind of women who are very more of party goings, and they happen to go to party all night. And as actually we have stated earlier, usually the children start hearing from 4 months of gestation when the child is in mother womb. So if a mother is a very party going lover, and if they continue to go, it will not only affect the mother but also the children. And in some cases we have infection, torch infections, which actually is a very harmful infection which causes hearing loss in children during the prenatal stages. And once the child gets born, so in some children what actually happens is the mother is not able to give a normal birth, and you have to go some C-section, so you have to go under surgery. And even after the birth, the child tend to be having a very low birth weight, and some they get jaundice and all, and that actually is all contributing factor which will cause hearing loss in children. And in our population, we happen to see more individuals with a high level of jaundice, so which actually is precipitating the cause of hearing losses. And some children, they don't have any significant history during their birth and at time of birth, but however, once they get older, they tend to have some kind of because of infection, long-standing infection that actually causes injury to the nerve, which causes hearing loss in children. Not only that, they tend to have some traumatic accidents which actually cause harm to their ear. So that actually causes some postnatal infections, and some having tuberculosis, taking long-term medications, and some orthodox drugs actually causes hearing losses. So that's why we can classify the causes into 3 parts. It depends upon when the child is in mother womb, after they are born, and after they are given birth. Once they attain the adolescence, some infection, some diseases causes hearing loss in children.
Yes, Ms. Sangmo, I'll get back to you with the diagnosis part. So doctor, are there a certain group of people who are at higher risk of developing hearing loss?
Definitely. If you go by age, those above 50, your hearing starts declining.
Yes.
So the rate at which your hearing will decline will depend upon your genetics. So if your grandfather is a very good hearer, at 80 can converse proper good, so your genetics are quite strong. And if your family member at a very early age, at early age 45 starts hearing problem, and by 50 wears a hearing aid, then you are in a higher risk of people with genetic disorder who is predisposed to hearing. So age is number 1. Number 2 is those working in a very noisy environment, like in factories. That's why we have a regular ear checkup for those people working in Pasaka or wherever there's a lot of noise. Those working in the airport, those working in factories, they are higher risk group of cohort of people who are at higher risk. Other one is the armed force personnel, because they are exposed to firing. Firing has one of the highest decibels, 120, 140 decibels. Motor blasts have huge decibels. So one motor blast can completely damage your hearing if you are not being careful. So armed forces, and next are those people who are congenitally. For example, if your parents, both of your parents have some hearing disability from very young or from a very early age, the chances of the kids having hearing loss is quite high. Those are the groups of people who are in higher risk.
So, Ms. Sangmo, what do you advise or recommend those people who are at higher risk to follow any health instructions to prevent themselves from noise-induced hearing loss?
Well, yes, especially for children, for the higher risks, it's a very it will be very pertinent for parents to know that the child needs to get screened. If the child is born with some jaundice, any kind of high risk like low birth weight, they need to get the child checked before 2 years of age, because as I mentioned, 2 years is a very critical age for audition, and audition means hearing. It's very important for child's development of speech, and especially for those individuals who are working in industries. it's very important that they get the baseline audiogram done prior to the getting admitted them into the industries. So as for the international practice, what actually they do is they make the individual to undergo audiological test so that they can procure one baseline audiogram, and once they get enrolled themselves into the services, again they have to get yearly checked so that they can get assured that their hearing is maintained at what actually was seen in baseline audiogram. So it's very important that they initially get annual hearing checkup, and other thing is it's very important that they make the use of protective gears as mandatory as possible. So especially for the protective gears, they get helmet, where it's very important that because some helmet they actually help in reduction of noises, and they get the ear tips, some earmuffs to be provided by the companies. So it's very important that they should wear. Some they complain that it's very uncomfortable to wear, but however, I think it's better to protect their ears rather than feeling uncomfortable. So it's very important that they should wear the earmuff regularly, the ear tips regularly, and put that protective gear as much as possible. And those like the adolescents who are very music lover, try to minimize the usage of earphones. And if they're using earphone regularly, try to minimize the volume of sound they're actually listening to the music, and it's very important that they get the hearing checked. So these are some of the tips that they can follow to protect the hair.
Yes. So doctor mentioned that one of the most common hearing condition is the degenerative hearing loss, which is in aged people. So what are the restoration possibility or treatment options in our country, La?
So when we say restoration, age-related hearing loss basically is a natural thing. There's nothing that we can do to stop.
Yes.
But we can definitely delay the degeneration.
Yes.
How we can delay the degeneration is, number one, as my colleague 𝗪ષ mentioned, avoid exposure to loud noise, number one. Number two, be careful whenever what are you eating. If you're a diabetic, proper control of diabetes. If you're a hypertensive, good control of hypertension, because blood supply to the ear is the most important. If the blood is a single artery supply, if that artery gets blocked, is dead. So blood supply, blood pressure, and hypertension control. Then next is alcohol and smoking. Alcohol has lot of neurological issues. So as we all know that if you are a chronic alcoholic, your peripheral nerves, your limbs become weak. Similarly, the nerves in the ear gets weak. So those people, those who are age-related, that we cannot stop, but we can definitely delay. Once they reach, the problem with people age-related hearing losses, they can hear the sound, but they cannot understand. That's called poor discrimination. For example, if you tell me 100 words, I can repeat 90 words, because I can understand. But if you, for patients who are having age-related hearing loss, if you tell them 100 words, they may not able to, they will hear what you told, but they may not be able to repeat even 50. So it's a speech discrimination, real problem. So old people, what they say is, I can hear the sound, but I'm not able to understand, and they are frustrated. In between the couple, they have fight. One says something, others replies the opposite. So how we can manage, how we can prevent this? As I've mentioned before. And once they have reached the state where their speech has become poor, we refer to our colleague audiologists for hearing aids.
Yes. So how effective are the hearing aids, and what are the recent advancements in hearing aids in Bhutan so far?
Well, yes, like in terms of hearing aid, it actually depends. We Bhutanese have some kind of myth that once we put the hearing aid, we will be able to hear very clearly. But I must say that's not possible, because hearing aid is a machine, and machine is once our hearing is lost and when it's involved the sensory, it's very difficult to restore the hearing. So hearing aid is just to amplify the sound and enable us to hear, not exactly the natural hearing, but it will aid us to at least hear some environmental sounds. But discrimination, it is very difficult. So it depends upon how much hearing loss you have. If you happen to have a very severe kind of hearing loss, and if you happen to put a very poor type of hearing aids, it won't be effective. So it depends upon the degree of hearing loss you're actually having. But now I think the recent advances have been so advanced that now they're involved using the artificial intelligence. And well, I must say artificial intelligence has played a very major role in hearing aid. Now there's invention more of a smart type of hearing aids, where the hearing aid automatically, it actually recognizes the environmental noises, automatically it minimizes the noises and make it like very clear to the people, so which improves the sound qualities. But I must say, yes, with the invention, the people will be able to hear some kind of sounds with more of recent advances. Not only that, for the recent advancement in hearing aid, there's also some Bluetooth connectivities, like we have the hearing like phonic luminity, where they actually enable the people to listen to music directly by connecting their hearing aid to the smartphone, TVs and all. So they can directly just press some button and they can actually have direct access to the music.
So are all these advancements available here in the country?
For Bhutan, I think we're still in the process of getting that, but I think we have that Bluetooth rechargeable batteries we do have in Bhutan. So I think we have one private audiologist who's actually dealing with all that hearing aids, and we do have rechargeable, because earlier we tend to have button kind of batteries, which is very difficult for some individuals, because those who are living in a very far-flung area, it's very difficult for them to come here, purchase the hearing aid battery and go back. But now we have the rechargeable batteries where they can directly recharge using electricity. So yes, I think rechargeable we do have in Bhutan, but the AI system and the other we are yet to get them into our countries.
What about the follow-ups after prescribing them hearing aids?
So in our current practice, we actually recommend the individual to get the hearing aid program yearly, because once the individual get the hearing loss detected, we don't expect the hearing to get improved, we expect the hearing to get deteriorate, because with aging factor, which actually cause our hearing loss to deteriorate. So we recommend the individual to get the hearing again checked yearly and get the hearing aid program. That will be a very safer side for them, because some individuals, what they actually do is they complain that they're not able to hear well with the hearing aids. And when we dig back to the history, they tend to say that they have fed that hearing aid 5 years ago, and 5 years till now, I think there's a huge gap, and we expect deterioration in the hearing. So we enable the individual to follow regularly, like yearly, at least for yearly, so that they can get the hearing checked once more and get their hearing aids reprogrammed.
Yes, thank you, Ms. Samula. So, doctor, are there any medications or medical treatments that can cause hearing loss as its side effects? I mean,
definitely, yes. There are quite a lot of drugs which can actually damage your hearing. Just as saying goes, if too much, even your mother's milk is bad. So medicine is a poison, and if you give poison in a very calculated dose, it's a medicine.
Yes.
So there are a lot of drugs. Among the drugs, the foremost drug that causes hearing loss is anti-TB drugs. Drugs used for tuberculosis. In Bhutan, tuberculosis is still a very prevalent disease, and among the tuberculosis there is MDR, multi-drug resistant TB, which means tuberculosis bacteria that doesn't respond to regular category 1 drugs. So in such cases we give injections, and among the injection, streptomycin injection is the most potent ototoxic drug, means a drug that causes hearing damage. So in those patients who are receiving MDR TB drugs, we make sure that before we start, we send an audiologist to get the baseline hearing assessed. Then every 3 monthly, or at least a monthly, we send them to audiologists, get the hearing checked. If the hearing deteriorates very fast, and if the patient is recovering, then we might try to reduce or adjust the dose, but life comes before the function. Hearing loss per se is not life-threatening. That's why hearing loss is a neglected disease. That's why 3rd March is selected by WHO so that people understand hearing is important and it's recognized. So that's why patients who are on TB, you should be very careful, and those who on TB drugs, if your hearing is not checked, please check. There are other drugs, antihypertensive drugs, and anti-malarial drugs, and as simple as some heart disease drugs like furosemide can also cause hearing loss. Among the drugs, if I list down, I think nobody can remember. So only thing is, you just remember anti-TB drugs is a #1 cause.
Yes, doctor. So Ms. 𝗪𝗱, I've heard that hearing loss can impact speech. So can you explain us about its relation? How does hearing loss impact speech?
Yes, hearing loss, it will definitely affect one's speech and language development. So as mentioned earlier, the initial hearing starts from 4 months of gestation. The child starts hearing the voice of a mother. Once the child gets born, initially prior to the speech development, it's very important that the child have an audition, which I've mentioned as a hearing and listening. And prior to the important part is the listening. In some children, what actually happens is they actually hear the sound, they're not able to process in their brain. That's called listening. So in that case, the child will not be able to develop properly. So therefore, it's very important that the parents should get their child screened for the hearing, so that they can be assured that the child have adequate development of speech. And what actually happens is our brain is such a complex system that all are interlinked together. So we have the hearing center and the speech center almost near to each other. So initially the thing that has been heard from outside actually goes to the hearing center in our brain, which actually process the impulses, and then they get transmitted back to the speech center, where the speech center will transmit the impulses to the different parts like our oral part, tongue and all, which actually will process, and then it causes production of speech. And if a child has no hearing, then there won't be any kind of impulses going to the hearing centers. And there's no impulses or information going to the hearing center, obviously we expect no impulses to be going to the speech center. So if there's no impulses and no information, we can't expect development of speech. So it's very important that the child should have hearing and listening prior to development of speech. If the hearing and listening is adequate, then the child will have a very good development of speech if parents have intensive stimulations. What actually happens is the child tend to have a good hearing, but they fail to give some stimulation to the child. That will also cause delay in speech. So it's very important that first they get the hearing check for the child, and then provide intensive stimulation so that there's no delay in development of speech.
Since it's about the time that we wrap up this session, I'd like to ask Doctor, how can we tackle the stigma surrounding hearing loss in our Bhutanese society?
We can come back to the theme, changing the mindset.
True.
So our mindset is, the moment we see a deaf one, we say, Namchu Jatu. So there is definitely, so the new generations should not, first of all, stigmatize, should not label them. Because every one of us, after the age of 50, our hearings go down. We are all going to become Jadus one day. So change the perception, change the mindset. And the next part is empower yourself to hear and ear care, hearing and ear care. So it has a deep meaning, because we are unnecessarily being exposed to various kind of noises, machines, vehicle, so many noise. Our ambient noise has drastically over last few years or last few decades have increased. So we are unnecessarily being exposed, and self-harm, unknowing self-harm. Just like my colleague mentioned, listening to loud music, going to discotheques, karaoke, listening to high noise, and you are not aware, and the damage once done is irreversible damage. If you come later, there's nothing much we can do it. So prevent from that. These are the things I feel are important.
Yes. Any last words?
My last word will be, I would encourage the people to change their mindset, get themselves checked, don't let the children to suffer, get them checked as early as possible so that they can have a very adequate development. And for the young adults, please refrain from using too much of earphones and listening to a loud sound.
Yes. So that brings us to the end of today's episode, and we are pleased to have participated in this global move in observing World Hearing Day, which serves a vital reminder of the importance of early detection, prevention, and access to hearing care. And thank you so much, Doctor and Ms. Sangma, for your time, and your expertise have been invaluable. And thank you so much. That is all. Until next time, take care. Goodbye.